Thank you for joining us today. I'm Jefferson County Manager Colonel Don Davis, and I'm joined by officials from the Jefferson County Public Health Department, Jefferson County Emergency Management Office, and the Jefferson County Sheriff's Department. As you've probably heard, there is an expanding global outbreak of respiratory illness caused by the novel coronavirus named COVID-19. This is a rapidly evolving situation, and multiple county agencies, including Jefferson County Public Health, the Sheriff's Office, Emergency Management Team, Human Services, the County Manager's Team, and the Board of County Commissioners, along with all of our departments and offices, including our internal services like IT, have been working in collaboration with the Colorado Department of Public Health and Environment to closely monitor and respond to this outbreak. It's normal to feel worried during times like this. While it's possible that a severe outbreak will not happen here, we should all use this time to learn about the virus, know the steps we can take to protect ourselves, and prepare. Here at the county, we are conducting business as usual, and our services are still available through our normal means. However, we are already planning and making sure we are prepared to revise the way our services are provided if we need to, and we encourage our business partners to do the same. Make sure you have plans in place for your employees and your customers. We are doing everything possible to limit and slow the spread of COVID-19 in Colorado and in Jefferson County. Current public health efforts are focused on containing the spread of this virus and mitigating the impact of this virus. With that, I'm going to turn it over to Christine Billings, Incident Commander and Emergency Preparedness and Response Coordinator with Jefferson County Public Health, to give us an update on the situation in Jefferson County.
Thank you, Colonel Davis. Across the United States, there have been a total of 647 cases of COVID-19 in 36 jurisdictions, including the District of Columbia. Unfortunately, these cases have resulted in 25 deaths. Today, Colorado Governor Jared Polis declared a state of emergency in Colorado. This declaration allows the state to access additional resources to better reduce the spread of the virus. As of noon on March 10th, there have been 15 presumptive cases of COVID-19 in Colorado, and one indeterminate case that is being treated as a presumptive positive. They are considered presumptive positives because they have tested positive at the state level and are awaiting confirmation at the Centers for Disease Control and Prevention in Atlanta, Georgia. These cases have been located in Arapahoe, Denver, Douglas, Eagle, El Paso, Summit, Larimer, and Gunnison counties. At Jefferson County Public Health, we have worked and are continuing to provide timely information about the outbreak to the Jefferson County and Gilpin County communities. Share guidance with our healthcare providers so they know how to safely care for people with possible COVID-19 infection. Support our local hospitals and other health and medical partners with requests for information and logistics. Actively monitor the situation and refine our response and recovery plans. Work with county officials, schools, businesses, law enforcement, fire, EMS, and other partners to plan for a potential outbreak. Follow federal guidance while working with the Colorado Department for Public Health and Environment to assess and test suspected cases, identify people who may have been exposed to cases, and determine the need for monitoring, isolation, quarantine, or other restrictions of movement and activities. We have activated our Public Health Emergency Operations Plan and are using the Incident Command System for enhanced and coordinated response efforts. With that, I'm going to turn it over to Dr. Mark Johnson, Executive Director of Jefferson County Public Health, to explain a little bit more about COVID-19 and what our community members can be doing individually to help prepare and prevent the spread of disease.
Thank you, Christine. While there are a number of different types of coronaviruses, COVID-19 is a new coronavirus that up until recently has not been identified in humans. Thus, there is no community immunity, and all of us are susceptible. As I try to explain to my 4-year-old granddaughter, viruses are like little tiny balls that you cannot see that are filled with stuff that makes you infected. On the outside of the ball, there are spikes. Some of these spikes make them very sticky, so they stick to surfaces and stick to humans. Some of them are spikes that help, once they get inside the human, to break open human cells and take over the reproduction in those cells so that they continue to make more and more viruses. This means that there are certain people who are at high risk for getting the disease and certain people who are at high risk for getting severe disease. People who have been exposed to other people who are sick are those who are most likely to get infected. People who live in communities where there is community spread of COVID-19, healthcare workers who are working with patients who have COVID-19, people who are in close contact with someone who has COVID-19, and travelers returning from international communities where community spread is occurring. People who are at high risk for getting very sick from COVID-19, including older adults, especially those who are over 80, people who already have chronic infections or chronic medical conditions like heart, lung, or kidney diseases, pregnant women, or older adults who have chronic medical conditions who are at the highest risk. Current symptoms for COVID-19 include things like fever, cough, and shortness of breath. People who have COVID-19 may be infectious from the onset of their symptoms. At this time, there is no vaccine for protecting us against COVID-19, and there are no medications approved to try to treat it. Thus, if you have symptoms that are similar to what I just mentioned, fever, cough, shortness of breath, we advise you to stay home and manage your symptoms as long as you can. We want to reduce the transmission to the extent possible. If, however, you feel you need medical care, please contact your primary caregiver and schedule a visit. Let them know you think you may have COVID-19 so they may be prepared for you when you get to their office. Use 911 only for emergencies requiring immediate life-saving care, and let them know also that you are concerned that you have COVID-19. Restrict visits to hospital emergency departments or to urgent care, again, only if you need immediate care. If you must visit an emergency room or an urgent care facility, please, again, call ahead and let them know you think you may have COVID-19. While it's important to take the steps that I just mentioned to try to prevent the spread of this disease in the community, there are things that you and your family can be doing at home to prevent getting ill. One of the best things you can do is to wash your hands frequently with soap and water. Cover your nose and mouth with tissues if you are coughing or sneezing. Throw the tissues away and then wash your hands. Try to avoid touching your face, including your eyes, your nose, and your mouth. Disinfect frequently objects that are touched, like surfaces around doorknobs, telephones, computers, and other places. Avoid being around people who are sick with symptoms of cold or flu-like illnesses. If you are sick, stay home and away from public places. I would now like to turn things over to Ray Fleer, Jefferson County's Emergency Management Director.
Hello. At Emergency Management, we want you to know that our first concern is for you, your health, your safety, along with the health and safety of our first responders, fire, law enforcement, and emergency services. To that end, we want you to know that if you need us, we'll be there. We are actively working with Jefferson County Public Health, who is the lead agency in the coronavirus fight. We are also coordinating with the Division of Homeland Security Emergency Management, the Colorado Office of Emergency Management, municipal emergency managers, and R1 schools. We would also like to reiterate that this is probably a very good time to think about the possibility of an extended stay at home. If you find yourself in a position where you become ill or you're caring for a loved one who has become ill, we encourage you to think about how you would plan for that eventuality ahead of time. I would like to refer you to a couple of very good resources to plan. Some of the things that you may want to consider would be, do I have enough food, water, first aid supplies, pet supplies, baby supplies, things like that. A good planning aid is to go to the Center for Disease Control website, cdc.gov. Also, another planning tool is provided at FEMA's website, ready.gov. There you can access useful information about how to plan your stay for an extended period of time. The last thing that I want to reiterate is something that I learned from a very smart man, Dr. Mark Johnson. In a meeting that we had, he made the statement to remember, please, germs don't jump. And that's stuck with me and all of my cohorts at emergency management, as we routinely do the kinds of things that are good practices like personal hygiene. Washing your hands, don't touch your face, eyes, nose, and always respect personal space. But I thought that was great advice from Dr. Johnson. Again, if you need us, please feel free to reach out. We're at Jefferson County Office of Emergency Management. Thank you.
Hello, I'm Jeff Schrader. I'm the Jefferson County Sheriff. And we have very competent people throughout Jefferson County, as you've heard, in our emergency management function, in our public health function, and in our public safety functions. And today I'm going to talk briefly on behalf of chiefs of police throughout Jefferson County and fire chiefs throughout Jefferson County as well. While we're experiencing this epidemic, and while the governor has declared a state of emergency, you may see a different response if you need assistance from either your local law enforcement agency or fire department, either for a public safety need or for a health need. There may be slightly different response than you might see in a normal circumstance. We want to make sure that our public safety officials, deputy sheriffs, police officers and agents, and firefighters are all protected so that they are as safe as they possibly can be, so that we can keep you as safe as you possibly can be. So when somebody shows up, it may be that they are wearing protective gear different than they would in a normal circumstance. And it may be that if they are seeing that you are sick, they may ask you to be wearing some additional protective gear. And we would ask that you comply. The second area that I want to talk to you about is what we do at the county jail to make sure that the inmate population is as safe as it possibly can be and is as healthy as it possibly can be, even when we experience these difficult circumstances with communicable diseases that get carried throughout a facility or a closed environment. In the jail, we make sure that inmates are always screened when they enter the facility, both for their psychological well-being as well as for their general health. And while the inmate acuity or the general overall health tends to be lower than what we see in the general public, we do also make sure that there is appropriate and adequate health care that is provided by a contract medical provider while inmates are in the jail, that there are vaccinations when necessary, and if it becomes necessary, that an inmate or inmates would be quarantined from others so that things don't spread in that closed environment. We know this, that 95% of the people who are incarcerated in the Jefferson County Jail will return to our communities. And we want them to do so as healthy as they possibly can be. But in the instances where necessary, we also have the processes set up to transition people back with health plans. That leads to the last point that I want to make, and that's about continuity of our operations. We in public safety and Jefferson County as a whole all have prepared for different emergencies that may happen, different circumstances that may happen, and things that we may have to respond to. And when we do, we know that we may have to return to a different state than what we found. So in all of those organizations, we have pre-planned for continuity of operations for those services so that we can continue to make sure that our public is as safe and as healthy as it possibly can be. And to wrap this up, I'll turn this back over to Colonel Davis.
Thank you, Sheriff Schrader. While there is no way to know exactly how COVID-19 will spread or what the impact of our county will be, we know that we are a strong community that has faced very difficult challenges in the past and that we've come together in times of crisis. Staying united and positive during uncertain times is one of the most important things that we can do as a community. We also want you to be aware that there are posts with misleading information circulating on social media regarding COVID-19. Please note that only the official county or state sources, such as Jefferson County Public Health, Jefferson County Public Schools, Jefferson County, Colorado Government, and the Colorado Department of Public Health and Environment, will officially notify the public about new information. Please utilize these sites as your primary source of information. This will ensure that what you're looking at is valid and it's truthful. Thank you so much for joining us today for the important conversation about COVID-19. Again, we want to emphasize that answers to many of the most frequently asked questions are available at www.jeffco.us/coronavirus or by calling the CO helpline at 303-380-1687. Or you can email cohelp@rmpdc.org for answers in multiple languages such as English, Spanish, Mandarin, and more. In the meantime, please be vigilant with your interactions with others and your hygiene. Stay healthy, stay safe, and stay tuned to the Jefferson County websites and the Colorado State sites for more information and updates as the situation changes. Thank you for joining us today. Your Jefferson County team is here to support you and take care of you. Thank you.